Hello everyone, this is Dr. Sheenam Bansal. Today we will learn about how to do adductor and iliopsoas lengthening with proximal hamstring lengthening. Firstly, we know adductors help in adducting and iliopsoas is for flexion, hip flexion, and proximal hamstrings are there. Firstly, how to do adductor lengthening. You have to give an incision, transverse incision, parallel to the groin crease, 1 to 2 centimeter distal to the groin crease. Parallel, the incision will be parallel to the groin crease. You have to put the hemostat, curved hemostat from medial to lateral side. Be careful not to perforate the fascia overlying the adductor brevis and thereby risking injury to anterior branch of obturator nerve. Because we know above the adductor brevis, there is anterior branch of obturator nerve, and below the adductor brevis, we have posterior branch of obturator nerve. Full muscle fibers of the adductor longus are divided. With medial retraction, the muscle compartment surrounding the gracilis is open. Now we have done the adductor longus release. Now we will go in the medial compartment to the gracilis section. How do we know, how do we recognize if it's gracilis or adductors? The child's knee is extended and flexed to document that the muscle is gracilis. The muscle which becomes tight with knee flexion and extension is gracilis. Cause we know gracilis that is attached is crossing the knee joint, but adductors don't cross the knee joint. Electrocautery is utilized and the muscle is transected. Which muscles are we talking about? Gracilis. If hip abduction, now we have done two releases. First is adductor release. The second is gracilis release. If hip abduction with hip and knee in extension is less than 45 degree, attention is directed to adductor brevis. Even after releasing adductor and gracilis, now if there is abduction, hip abduction is less than 45 degree. Now we will do the adductor brevis release. We can see if the patient is non-ambulator, then we can do the interior branch of obturator nerve transection. But transection can be done. But if we can also do only adductor brevis lengthening. After, if the child is a non-ambulator, the anterior branch of the obturator nerve can be transected after identifying all four branches of the obturator nerve. The nerve is clamped with a hemostat and a 1 centimeter section of the nerve is removed with cautery. Adductor brevis can be lengthened by retracting anterior branch of obturator nerve laterally, resecting muscle fibers of adductor brevis perpendicular to fibers direction. Precaution is taken to protect the fascia beneath it to protect the posterior branch of obturator nerve. Care is taken at the deep end of the adductor brevis to avoid branches of the recurrent femoral nerve, femoral vein and artery. In the ambulatory child, only psoas tendon is divided, not iliacus, from lateral to medial side to avoid pointing the blade towards a neurovascular bundle. If the child is severe quadriplegic, all the muscle fibers are released 1 centimeter above the cartilaginous tip of the lesser trochanter. See, firstly, to release the adductor, we have given incision parallel to the groin crease. Then we have divided the adductor longus tendon. Then see here we are seeing adductor brevis muscle and anterior branch of obturator nerve. Here we have pectineus muscle And you can see here pectineus muscle is there and adductor brevis is there. You can see here the cut is given in the iliacus muscle. After cutting iliacus muscle, you will put your finger into the in between the adductor brevis muscle and you will open it. That's how we do adductor longus release and gracilis release and iliopsoas release.